1131 or visit us online at brickcity.com.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock, Joe, about 50 years ago, I went to the dentist with my mom and dad, and the dentist said, that ought to last you 40 years. And he was right. About 40 years later, my fillings started falling out. And you know, it's just been one of those things. And
well, that dentist is not around this area anymore.
No good. Now, this was up in New York. And I don't know if that was bad. 40 years seems like a good length of time for a filling. Dr. Simon Amir is in the studio. You've been hearing his friendly voice on the promos for this moment. He has been practicing family and cosmetic dentistry locally since 2003. He's a University of Florida alumni, a Gator. Good to see you.
Oh, gee, you had to put that in there.
Focuses on cosmetic and general dentistry, as I mentioned, with an emphasis on patient comfort. That's always good to know when you're talking about dentists. He regularly volunteers at the Marion County Health Department. He is a dental co-director at the Freedom Clinic, and Joe, he plays guitar.
Oh, now you two have something in common.
And piano.
Oh, and a piano. Sorry. Well, I play the radio.
And drums.
That's correct.
Right?
And the drums?
Oh, that's right?
We could just talk about that for half
and
an hour.
And mountain biking.
Yes.
Oh, my God.
Oh, I'm with the drums.
Does your wife do all the above? Are you part of the band?
For those who can't see her, she's in the corner and you can't hear her. She doesn't want to be on.
So
she's out there.
Good morning, Doctor.
Good morning.
Thank you for coming in here.
Thank you for having me.
So 50 years ago, the prognosis, the estimate was that fillings lasted about 40 years, I guess. Is that right?
Yeah, I mean, a lot of that depends on, the material that you're using.
Look at your teeth. They're great.
They're not bad. Yeah, I thank my parents for that. It's all natural.
All natural?
That is awesome.
See, so he hasn't gotten in any fights yet, so.
Can we get, fake teeth to look that good?
We certainly can. I do it all the time.
See? Now I'm talking to him, looking at his dang teeth. Will you stop that now?
But, yeah, I mean, even nowadays, the materials can last a long time. It really depends on how you take care of them. And I tell people that all the time. It's, a lot to do with that. The same material in one person can last, 30 years, 40 years, and in someone else it could last 1 year.
Right. That is not a Gainesville accent.
No. I was born and raised in London, England.
Which is
that's
what I'm hearing.
Place notorious for bad teeth.
Why is that?
I think braces are just not very popular in England even today. You guys haven't heard that?
No, never heard that.
No? Okay. Yeah. My dad's a dentist there actually still today. He's right in the middle of London.
That's a good excuse to go home and visit once in a while.
Yeah.
In your dad's younger days, dentistry was a lot different than it is in today, right?
Yeah, absolutely. I remember him when I was a kid. We used to go to his office every day after school, and he'd just be running from patient to patient. It was all doing those metal fillings, they used to.
That's the ones that fell out.
Yeah, right. That's right. And just doing caps that really turned out pretty ugly because the materials weren't as cosmetic as they are now.
Right.
And there wasn't as much of a focus on prevention as there is now. There wasn't as much focus on treating gum disease as there is now, at least over there. But now things have progressed. There's a lot of digital technology out there. There's lots of new things.
So what do we do wrong, and what can we do to prevent dental or gum disease? What can we do to prevent it?
Well, there's a few things. I mean, the very basics would be use a fluoride toothpaste twice a day. Brush for 2 minutes. We all have smartphones
I do this.
Okay, we all have smartphones. We can time ourselves. Know that you're using the right techniques. Now you have YouTube. You can just go look online and see how to do it. I do have a little guidebook, an owner's manual for teeth here.
Oh my goodness!
And,
look at that.
If people that are listening want a copy of this, the first 20 people that either email into the station, or
we'll give your email out before we leave.
I'll send you a copy of that for free. So the right techniques, you got to get in between your teeth. as just as
Flossing,
well.
is that what that's called?
Yeah, flossing. Definitely,
You know what?
absolutely.
I don't use the old-fashioned floss. I use that floss stick. Is that just as
Yeah.
good as the string?
You know, anything that you actually use to get between your teeth is better than
that's
nothing.
good. That's good
you know?
stuff. Okay.
But
What about the water pressure?
I get that question quite a lot.
With, not alone, but with flossing.
Exactly. It's a great adjunct. That's key with flossing.
Oh, really?
You know, you
Okay.
got to get something to actually mechanically remove that bacteria from in
And wash
between
it
the
out of
teeth.
there.
Exactly, yeah. And then that can flush it out. I have some patients that just use the water pick
And say, oh, that's good enough? No.
Yeah, it's not good enough. So, you know, those few things, most people know how cavities form. I mean, are you guys aware of how you get cavities in the first place? Why we get these holes in our head?
I'll tell you what I was told. I don't know if it's true. It's sugar creates bacteria, creates cavities.
Yeah, that's
Is that basically it?
In a nutshell, that's it.
A layman's way of saying it.
Yeah,
I had another question going back to preventive.
Go ahead.
You have the old-fashioned, no, they're not old-fashioned anymore, a toothbrush.
Mm-hmm.
Scrape, twist, and all that. Well, now they have the ones that,
Those are
yes,
great.
no, maybe, what?
Those are great if your dentist notices or you feel like you're not able to, you know, manually do the movements with your manual toothbrush. Like if your dexterity is decreasing due to arthritis or something like that, then those electric toothbrushes are vital. Okay, a person who's doing a great job, I don't tell them to switch. You know, I personally use a manual toothbrush, although I have both.
Can you tell by looking? Can you tell if somebody isn't doing it right?
Absolutely, yeah, because you will see that, you know, after you've had a meal, if you go and take your fingernail and scrape the front of your teeth,
Yeah.
right? What's that stuff that comes off? That's the bacteria swimming in a sea of sugar, all right? We call that plaque, right? So when someone comes into my office, I have my big magnifiers on and my little spotlight in their mouth, and everything's bright as day. I can see that plaque, particular spots on their teeth where
Right,
they might be missing, and oftentimes my patients everywhere will be perfect, but then
Yeah,
there's this
yeah.
one spot that it's obvious that the brush hasn't hit for weeks. You know, so it's
Oh, really?
Just technique, you know, just technique.
I don't know if you can tell. You're a dentist. Maybe you can. But I'm blessed that the bad teeth are not in front. So at least when I
I see.
smile, it's not too bad, you know. But I
Right.
do have a lot of missing places.
I see.
Do the things that they drill a hole? Joe has one of these, right?
A dental implant.
Yeah, implant, right? Did you put it in Joe's head?
I
No.
did not.
No.
In my head. In my head. Not my jaw, my head.
But I okay. If somebody has one, I guess I can listen. But what if somebody has lots of them? Isn't that compromising the jawbone?
Yeah, I mean, if you're missing multiple teeth, things start to happen. Number one, you start chewing on your front teeth. These poor little delicate front teeth that were only meant to like bite into food and break off chunks are now doing all this extra work.
Oh, that's me. Yeah, I do that.
They fracture more. They wear away a lot quicker. The back teeth that you have remaining, if they don't have a partner to chew against, they start trying to find one. And they'll start moving and shifting, and you can get what we call bite collapse, where you end up with, in a lot of cases, the remaining teeth hitting against the gums.
Oh, not good.
the
They
other
go up
side.
that far.
They go up that far, yeah. It's crazy. And that's very time-consuming and expensive to fix once you're there.
So what is the solution?
The solution is, you know, once you have, let's say, more than one missing tooth in the back, you need to get some kind of replacement. And it can be something
denture?
like dental implants, but it can, you know, there's more inexpensive options as well. You can do a removable partial denture, and there's, you know, different types.
You do
of
all
those.
this in your office?
Yeah, we do. The actual surgical implants, I happen to have an identical twin brother, Dr. Jamie Amir, who's a
Really?
dentist as well in town.
Yeah, I'm glad he didn't pull that one come in and say, I'm here to come, and the other one didn't come out. I'm glad he didn't do that to
There's
me.
two of, in fact, someone that was on your radio show, I guess just an hour ago or so, stopped me in the parking lot and said, "Hey, Dr. Amir," and I didn't know who she was.
Oh.
And this happens to me, you know, every other day.
okay.
Yeah.
And she said, "Oh, I don't know which brother you are, but
I don't know which brother you are. Yeah.
She said, "I wanted to thank your brother." She says that you know, he was very kind to her and helped her out one time. So,
Nice.
anyways, but yes, he does implants. He does the surgical part that stays beneath your gums. I do the part that you can see. So
a tag team.
We tag team, yeah.
But if money was not an object, could you replace all of them?
Absolutely.
With implants?
Yes, absolutely.
And that doesn't compromise the jaw?
No. As long as you do things the right way. Sometimes your jaw is already compromised by not having teeth there. You'll lose bone over time, just like an astronaut loses bone while they're in space because they're not getting the stresses of gravity.
Oh my gosh!
When you're not getting the little stresses, through chewing on your teeth, that gives your bone a signal to stay there. So once you lose that, you sometimes need to have bone added before you can put implants in. But once
bone added, you can do that.
Yeah, you can absolutely do that. Yep. You can use your own bone. Let's harvest it from somewhere else. You can get bone from your chin.
No,
that sounds scary. But other places in your jaw, they can even when they're taking teeth out, they can harvest a little bit of bone if needed.
Amazing! I didn't know that.
Yeah, you can take cow bone, cadaver bone. There's all kinds of different
George
options.
Washington had animal bone in it, didn't he?
He supposedly had wooden dentures. There's been all kinds of interesting options. For
be my luck, I get a cow bone over the rest of it. I'll go moo.
One thing I neglected to say when I introduced Dr. Amir, he's with Grand Oaks Dental Care. So we'll be right back to find out more about dental procedures and how we can make our teeth healthier when we come back with Dr. Simon Amir.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Friday, a mix of clouds and sun with a shower and thunderstorm in the area through the evening hours. High today 88 to 92. Then later Friday night, partly cloudy, low 74 to 78. Saturday, partly sunny with an afternoon thunderstorm in the area, high 90 to 94. And for Sunday, more clouds and sun with a couple of showers and a heavier thunderstorm, high 87 to 91. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Hi, I'm Seth with AA Lock, Dock, and Security. Have you ever thought about the locks or security on your house or business? Have you ever wondered why the keys to your new car cost so much? Well, at AA Lock, Dock, and Security, we can help with securing your valuables. We can even replace those expensive transponder keys. We can give you the knowledge that no one else will. Call AA Lock, Dock, and Security at 867-1965. That's 867-1965.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
I'm Jan Marino from Palm Garden of Ocala, and I'd like to tell you about the Palm Garden Way. We promote individual care, of course, but we also encourage GEMS. That's going the extra mile, and these are thoughtful individual gifts that make each guest stay special. A gem could be a daily latte or a new book or something else that means a lot to our guest. To find out more about the Palm Garden Way, take a tour, located on the corner of 27th Avenue and 34th Street in Ocala.
All right, 18 minutes after 11 o'clock, 88 degrees. This is about as warm as it's expected to get. There is a 40% chance of rain mentioned for today, and pretty much just expect that to happen again tomorrow and Sunday. All right, Dr. Simon Amir is in the studio from Grand Oaks Dental Care. The phone lines are open if you have any questions about teeth. Dr. Amir, do you work with children as well?
I do. I see kids as young as 6. We like seeing families a lot. We have a room in the practice, which is just set up with video games, movies, bean bags. You know, it's really cute. You can go on my website.
I'll play with that stuff.
I was just thinking, my game.
Yeah, it's cute. Sometimes the parents will go in there too.
Sure. Well, we're testing it for the kids.
But yeah, we use the laughing gas and stuff, and I have my little tricks.
That stuff.
Bribery works wonders. I have a wad of $2 bills in my pocket right now that go out to
no
the
way.
kids. Yeah.
You give them out to the kids?
Yeah.
If they're good or whatever. Right?
We have little cute vending machines with toys in there, and I had gold tokens made as well, and that they can use when they're good as well.
You have a phone call, so if you put your headset on, you'll be able to hear
Sure.
the caller, and then and I wanted you to repeat what you said off the air regarding how other animals don't get cavities. Good morning. Thank you for calling and for waiting. You're on the air with Dr. Simon Amir.
Yes, thank you. So, doctor, when you're purchasing toothbrushes for yourself or your children, how do you determine whether to buy a hard bristle, a medium, or a soft bristle, or what would be the best way of doing that?
I always recommend, and most dentists will agree, that soft bristle brushes are better. The harder brushes can abrade teeth, and I've seen there's a lot of toothbrush damage that we treat, as well as cavities and gum disease.
Oh my gosh, really?
You end up with the look, imagine your tooth like the trunk of a tree. It's like someone took an axe to the side of it. It's still perfectly hard, but you've abraded it away with brushing back and forth at the gum lines. So I recommend extra soft is what I give out at the office. But spend a little more, a few bucks on a good soft brush. I like the Oral-B ones that they have, out there in the grocery store. But yeah, that's what I recommend.
We do have another call. Good morning. You're on the air with Dr. Amir.
Yes, I'd like to ask the doctor, you do implant?
Yes, as I was saying to these guys before, I do implants in conjunction with my identical twin brother, Jamie. His office is just about a mile away from mine. The patients will usually come to me first and get a treatment plan and figure out what they're trying to achieve with implants and what the other options are, and then we kind of team up.
So where you located? Are you in Florida?
Yes, Ocala, Florida.
Ocala, okay.
Yeah.
I'd like to know what happened to the stem cell for the teeth that they were doing a study, and the study it was complete. What happened exactly?
And could you repeat the question? I'm not sure if I understood what you were...
The stem cell. It was a study on stem cell for the teeth to grow.
Oh, right, yeah. So that's definitely something that's they're continuing to do research on. I mean, one of the funny details I heard was that they've managed to make a molar tooth grow on the back of a mouse.
Wow.
Wow. So things are coming. Eventually you're not going to get dental implants anymore. You're going to get your own teeth growing.
Before
we're not there yet.
Next call, she did ask where you were located. What is the address?
I'm at 2575 Southwest 42nd Street, which is the Publix Plaza right across the street from Trinity Catholic High School in
That's
Ocala.
much easier to find that way. Go by a big landmark like that.
Yeah, absolutely.
You'll never remember the address. It's 20, across from Trinity High School. There we go.
That's good.
Yeah, it's a
All
great
right.
plaza.
Good morning. You're on the air with Dr. Simon Amir.
Good morning, Larry. This is Matt. I had a question for the doctor. He mentioned about using fluoride toothpaste. And I've heard in the past, I know this is controversial, about fluoride could be negative. I just wondered the doctor's take on that.
Well, absolutely. I mean, the EPA just a couple of years ago reduced the recommended amount of fluoride in water from 1.2 parts per million to 0.7 parts per million, which is that's like a 40% drop.
Yeah.
And why they were doing that was because people were getting too much fluoride and it was actually affecting their teeth. Too much fluoride for teeth is a bad thing. Now, people with thyroid issues, supposedly fluoride is not great for them. I think it would be okay for us to take out fluoride from the water. That's a bigger controversy, I think, than fluoride in toothpaste. But fluoride in toothpaste applied topically to the teeth.
You don't swallow it. That's the key there.
Exactly,
right?
and it actually becomes part of your tooth. It replaces certain minerals in the surface of your teeth, and makes them more resistant to breakdown by acids.
That's the big thing.
What is the difference? We do have another call, but real quick, what's the difference between stannous fluoride and sodium fluoride?
So stannous fluoride does tend to work a little bit better, but it has the effect of staining the teeth more. So both work really well.
Oh, really?
But we use stannous in certain situations and the sodium fluoride in others.
You have another call. Good morning. You're on there with Dr. Simon Amir.
Yeah, I'm the same person. What's his phone number?
My phone number at the office is 352-877-4926.
It's 877-4926.
26. Okay, thank you so much.
Thank you. Yeah, it sounds like she'll be showing up.
Yeah.
Okay.
Is that how we do it? We call and make an appointment, or do we just show up? Or?
It's we do take walk-ins, but we tend to be pretty busy. We're very lucky. We've only been open eight months at this location, but like you guys said before, I've been in town for so long, I've lots of loyal patients. So you're more likely to be able to be seen if you call ahead.
What are your hours?
We're open Monday through Friday, with every other Monday and Friday off, usually 8 to 5.
Okay.
We'll do extended hours sometimes based on circumstance, but yeah, we try and flip things around.
What is your take on teeth whitening? Everybody's, it's a phase. The fad, it comes, it goes.
First of all, let's differentiate between whitening toothpastes and products like that, which only really remove stain from teeth and make your teeth their original color. Okay, you got that on one end. Great for the coffee drinkers or smokers, but it's not going to actually make your teeth that were kind of yellowish to begin with, it's not going to make them whiter. The other things that we call whitening products are really bleaching products. They use some kind of peroxide base. The over-the-counter stuff can work, like Crest White Strips, those kinds of things like that. They don't weaken your teeth.
That was the thing.
That's the big thing. The products that you'll get from a dentist, and there's all different types, do tend to work better. I was never really impressed with, I don't know if you guys have heard of things like Zoom or laser whitening, where they put a light up to your teeth.
Yes, we heard all the. I have.
I use those. I used to use those, and I was never really impressed. Now we're using a newer system, which.
Oh, so you do that. You do offer that.
We do the in-office whitening, not that particular brand, but we have found that those work so much better if you do at-home whitening first, which kind of primes your teeth and frees up some of the deep inside stain that's just been wedging its way into the structure of your teeth for years. Freeze that up, then you do a power session in the office, and then you even follow that up more with some more at home. Pretty dramatic results that way.
Dramatic. I like that word, dramatic results. That is really good. You're talking time frame. Let's say someone comes and got dingy teeth.
So it really depends on what color your teeth are to begin with. It depends on age. But let's say a 55-year-old individual with teeth that are just pretty yellow-orange. They're going to whiten for up to 6 weeks at home, and then come in for an office just for an hour or two, and then 1 or 2 weeks after that. Yeah,
doctor,
that's not bad.
You got a text message. Please ask the doctor about insurance. What kind of insurance, I guess, would you need?
So I'm not sure if they were asking about dental insurance in general, or what insurances we take. We do take a few PPO plans. In general, if I have patients who do not have insurance and don't get it through their employers but need it, I refer them to the person that we get our insurance from. His name is Philip Olstein.
Okay.
He's here in town. Hi, Philip. He's great. He can, he's helped a whole bunch of my patients. Dental insurance is useful to a point, but it's very different from health insurance. Health insurance, you have a out-of-pocket maximum, right? Whereas with dental insurance, the insurance company has their maximum every year, and it tends to be pretty low. In 1960, the average insurance company gave out $1,000 in dental benefits a year. In 2017, it might be $1,500, which isn't exactly keeping up with the rate of inflation.
No, it doesn't sound like it.
Pick a tooth. Which one you want? Okay.
Dr. Amir, we've got about a minute left. I want to make sure we mention again your address and your phone number.
Yes, so I'm in the Publix across from Trinity Catholic High School in Ocala. Our phone number is 352-877-4926.
And do we use your website?
Our website is www.grandoaksdentalcare.com.
Okay.
Fantastic.
Can I squeeze in the last one real quickly? I got like 10 seconds to ask you this. You mentioned that we wouldn't have cavities if we ate like the animals. Could we raise our children so they never had cavities?
Absolutely. 100% preventable disease.
Oh, my gosh.
Oh.
Now you tell me.
That's what you call a cliffhanger. To be continued.
Yes.
Dr. Simon Amir and Mrs. Amir, thank you both for being in here this morning. That was great. We'll be right back.
is a Fox News alert. I'm Karen McHugh. An American is now reported among those killed in yesterday's terror attacks in Spain. The victim not yet identified. Police searching